In the world, every 2 minutes, a woman dies of cervical cancer, a disease preventable through vaccination and screening and treatable. Every death is a tragedy that we must prevent. In the Americas, cervical cancer is a common disease that kills nearly 38,000 women each year. The lack of equity in access to prevention and care is reflected in the difference in mortality rates. In Latin America and the Caribbean, there are 4 times more deaths due to cervical cancer than in the United States and Canada. That is why the Pan-American Health Organization is implementing the World Health Organization's strategy to accelerate the elimination of cervical cancer with specific goals for the year 2030 that is based on 3 main pillars: vaccination, screening, and treatment. By 2030, 90% of girls must be vaccinated with the human papillomavirus or HPV vaccine by the age of 15. 70% of women should be screened using a high-performance test such as the HPV test by age 35 and again by age 45. 90% of women with precancerous lesions and invasive cancer should receive appropriate treatment. The Pan-American Health Organization, PAHO, provides technical cooperation to the governments of the region to achieve these goals. Through the Revolving Fund and Strategic Fund, PAHO makes HPV vaccines and HPV testing available at a lower cost. It is time to join efforts to adopt and promote an ambitious, coordinated, and inclusive strategy to accelerate the elimination of cervical cancer as a public health problem in the Americas.